Welcome back to our channel, where we bring you the latest updates in medical research and healthcare. Today, we're diving into a groundbreaking study with significant implications for managing chronic kidney disease, or CKD. If you're a healthcare professional or someone interested in kidney health, this is a video you don't want to miss. The bottom line, for patients with chronic kidney disease, whether or not they have type 2 diabetes, treatment with Dapagliflozin significantly slowed the progression of CKD and reduced the risks of renal mortality and cardiovascular death compared to a placebo. Interestingly, there was also a notable reduction in all-cause mortality, although this wasn't the primary focus of the study. So why is this study so important? Chronic kidney disease is a major risk factor for death, and until now, there have been limited options to effectively prevent its progression. While ACE inhibitors and ARBs have been the go-to treatments, they mainly help prevent progression to albuminuria, but don't significantly impact serum creatinine levels. This is where Dapagliflozin, an SGLT2 inhibitor, comes into play. SGLT2 inhibitors were initially developed as oral diabetes medications, but their benefits extend far beyond just lowering blood sugar levels. Previous studies like EMPA-REG Outcome and Credence have shown that SGLT2 inhibitors like empagliflozin and canagliflozin can reduce cardiovascular and kidney-related events in patients with type 2 diabetes. However, those studies left a critical question unanswered. Can these benefits also apply to patients without diabetes? That's exactly what the DAPA-CKD trial set out to explore. The DAPA-CKD trial was a large, multi-center, double-blind, randomized, placebo-controlled trial that enrolled over 4,300 patients with CKD, with or without type 2 diabetes. These patients were followed for a median of 2.4 years, and the study was stopped early due to the overwhelming benefits seen with Dapagliflozin. This trial aimed to answer whether the benefits of SGLT2 inhibitors could extend to non-diabetic patients. Let's talk numbers. The primary outcome, a composite of a significant decline in eGFR, progression to end-stage renal disease, ESRD, renal mortality or cardiovascular mortality, was reduced by 9.2% in the Dapagliflozin group compared to 14.5% in the placebo group. That's a hazard ratio of 0.61, meaning a 39% relative risk reduction. Additionally, Dapagliflozin was associated with a reduction in all-cause mortality, though it's important to note that this wasn't the primary endpoint of the study. So what does this mean for clinical practice? Dapagliflozin now offers a promising new option for slowing CKD progression and reducing mortality in this population. It's effective regardless of whether the patient has diabetes, making it a versatile tool in managing CKD. However, keep in mind that while the benefits are clear, there are some risks, such as a slight increase in major hypoglycemia and volume depletion. Given the significant impact of this study, we can expect future guidelines to reflect the role of Dapagliflozin in managing CKD. For now, it stands as a strong option for preventing CKD progression and reducing mortality risks. In summary, the DAPA-CKD trial is a milestone in kidney disease management, offering hope to millions living with CKD. If you're treating patients with CKD or are interested in the latest advancements in nephrology, this study is one to watch closely. Thanks for tuning in, and if you found this video informative, don't forget to like, subscribe, and share with your colleagues. See you in the next video.